Hello, I'm Chester Connell. Under a mango tree, speaking of quality of life. Do you think about the quality of life? Or is the focus the quantity of life? How many cars, how much money in the bank account, and the rat race to keep up with the Joneses? As opposed to a concept of less is more, where you spend more time contemplating and planning and preparing so that when you actually work, you are efficient and effective. You do less but achieve more. There's absolutely nothing wrong with that. In fact, that is the way we should go, don't you think? Achieve more, do less. Spend more time in leisure, in rest, in thinking, in planning, in preparing. This is what wise people do. This is what wealthy people do. So, in St. Vincent and the Grenadines, as we seek to create a gridless SVG, an SVG with fewer cars, a better public transportation system, a more effective and efficient method of communication between ourselves and within ourselves. So, remember, think of a gridless SVG and how you can be a part of that. Let us think also about the food that we eat. Lennox Lampkin is a sustainable farmer. He grows his crops with no chemicals. He speaks to us about the value of adding value, the value of value adding. What about healthcare versus sick care? He speaks to that as well in this clip of Farming Off the Grid.
The value of value adding. You sacrifice your health to save money, and then you sacrifice your money to regain your health. So in other words, you're making a short-term, in your eye, lower investment, but in the process you destroy your health. So when you make your analysis, really the product that was slightly more expensive makes more economic sense. The quality of what you put in also affects your quality of life. So while a lot of people are shouting from the top of the hills about life expectancy increasing, I'm asking them, what about life quality? If your life length if your life is lengthened, but in the process the quality is in deficit, the length doesn't make any sense. So what you're trying to do is make people as unhealthy as possible and let them live as long as possible. So, and in the process, they tell you, oh, you need health care. But really, when you listen to what they call in healthcare, it's not healthcare. It comes with a cost. You could only care your health when you have it. That's why I say you could only conserve when you have. So when you're sick, and you have to go to a hospital for care, that is not healthcare. No. That is sick care. You're caring for the ill. And making somebody rich. In the right. You're caring for the ill. So we have to get even our language right. You know, say, look, you're talking about healthcare, and in the process where people are living longer, but the quality of their life is strongly reduced.